Hi, I'm Dr. Jumel Bornilia. I'm the Medical Director of the International Travelers Medical Center. I'm also the Medical Director of Immunoboosters Company, the first and only concierge medical and surgical clinic in the Philippines.
Doc, let's talk about certain skin conditions that a lot of our Filipino people have experienced. But what they may not know is the fact that some of their skin conditions may have relationships to their internal medical conditions. How true is it?
Okay, first and foremost, I just want to inform everyone that I'm not a dermatologist. I'm a practicing internal medicine physician. I deal with internal organ conditions, diabetes, high blood pressure, certain types of cancer, hormonal condition. When we say illnesses that can manifest a skin condition, number one, we have to we should always remember that the window of the body is the largest organ, which is the skin. If there are manifestations, say for example a rash, okay, we should think of the primary cause, the root cause. We're not supposed to deal with the symptom, but we should deal with the root cause. So if it's a rash, number one, consult your dermatologist. That's number one. If the dermatologist is not available, then that's the time you consult with us, your primary physician. Then our duty is to find out what's causing that rash, okay? It could be an allergy, it could be a food allergy, it could be a contact allergy from the lotion that you use, the soap that you use, or by mere exposure to an environmental factor, a fungal. Usually, if you're living in a condominium unit, you are exposed to molds, mildews. So, the doctor should be able to check and evaluate the root cause before giving a particular therapeutic protocol.
Doc, you mentioned that you deal with internal diseases like
Yes.
diabetic conditions, hormonal
Yes.
conditions. What could possibly be the effect of a diabetic patient to their skin conditions or to people having hormonal imbalances, for example? What do you think will be the major skin conditions that they may have to experience?
When we say diabetes, it's an immunocompromising condition. When we say immunocompromising, your immune system is too low. That is a predisposing factor, the diabetes per se. Hence, you are prone to fungal elements, infection. You are also prone to develop not only fungal condition, but any types of skin condition. The most common, usually there's this what we call peripheral neuropathy. If you have peripheral neuropathy, specifically when we deal with peripheral neuropathy, that also, no, parang they are somehow twinning with peripheral vascular diseases. Okay, if you check on the lower extremities of these diabetics, because there's poor circulation, you will see dryness, you will see scaling. If there's poor circulation, hence there's also poor nutrition, no? Poor oxygenation of that particular area. Hence, you'll be prone to infection. So that's bacterial infection of the skin. So if it's dry, the next scenario could be scaling, itchiness. So the patient would be in a haywire of itching on that particular region of his or her body. So, we should be able, number one, as an internal medicine doctor, we should be able to control first the sugar. No? Syempre, together with the control of blood sugar, we should be able to check and evaluate and at the same time treat, no, the skin condition caused by that uncontrolled blood sugar. So like what I told you, if you see a patient with a skin condition, always remember that we doctors should not evaluate the patient in by face value, we should know that the person is not a walking skin. Okay, the person is a human being, so we should be able to check everything. So suspicion is very important. Evaluate the cause of that particular skin condition. And I'm very, very particular with a soap that we use, specifically with internal organ condition, because the skin is just a manifestation. Okay, we're not supposed to be gang-ho with steroids, gang-ho with medicinal use. We should always go back to basics from the soap. No, we should check first the cleansing, the hygiene. Okay, so it's very important to evaluate. Number one, the cause. Number two, the daily exposure. The daily exposure, when you say daily exposure, that we clean, no? we take a bath on a daily basis. So we should use very mild, organic, natural for cleaning that particular area of the skin.
Let's deal with a particular case called psoriasis.
Okay.
What can you say about it? And if I have a psoriasis, what's the best remedy externally? I mean, if I cannot afford to see a doctor, for example.
Okay, psoriasis, like what I told you, I'm not, this is not my specialty. I'm not a dermatologist, okay? When I see psoriatic patients, I always tell them, it's not infectious, no? Hindi ka nakakahawa. We need to tell them that, hindi ka dapat pandirihan. I always refer my psoriasis patients to my dermatologist friends because they are the authority, no? The Philippine Dermatologic Society when it comes to psoriasis. Because number one, it's an autoimmune condition, okay? Unfortunately, we have, it's still a mystery. It's really hard to treat. But the only important remedy is number one, to maintain it. Okay, I don't want to give therapeutic protocol because we are not God. We cannot promise heaven and earth. But I always tell them to get at least an organic based soap. Okay, that would not exacerbate dryness, that would not exacerbate scaling, that would somehow help at least ease the discomfort of the patient with psoriasis.
Why is it important that when you are dealing with your internal medical conditions, what is so important that you need to align it with your external regimen?
Very important. It's very important. Number one, I'm very obsessive compulsive about this. Okay, before I give my skin treatment, if there's no available dermatologist, okay, before I give, at least the duty of any doctor is to give at least the first line of treatment. Okay, as internal medicine doctor or as a primary physician, that could apply also to GPs or any specialty, no? Even if you're an ortho or a surgeon, if there's a walk-in patient and the patient tells you that there's no available derma, okay, and the concern is skin condition, we should be able to at least give the first line, no? First line, or at least to ease the complaint, no? While they're waiting for the next appointment. First and foremost, we should be able to give them a cleansing, no? A very mild soap, no? That would somehow help and manage, no? That's the number one help that we can offer. Me as a primary physician, I need a soap which is very basic, very organic, natural, that would not exacerbate or would not give further damage to the complaint. Okay, as a rule of thumb, we doctors should somehow alleviate manifestations and not add insult to an existing injury. So it's very important, number one, to take care of the concern, and while taking care of the concern, you do no harm. That's very important.
You keep talking about this natural and organic soap. Can you tell us about what is this particular soap that you're talking about?
Okay, the Coco Cider, it's a very exciting product. You know why? It's really hard to match, no? To match a soap that would cater to all sorts of skin condition. Okay, there are inflammatory condition, there are allergic condition, there are infectious condition, there are conditions which are somehow hypersensitive, meaning if you just apply something, the patient will instantaneously react. So it's really hard to look for a product that would give any doctor a peace of mind. Tama ba yung nireseta ko? Magre-react ba siya or what? So when I came upon with this soap, I told myself this is the best soap that would give me a peace of mind, that if I tell my patients to use it while waiting for my blood test to find out what's causing that skin condition, at least I've given something that I know that signs and symptoms will be alleviated. It's very important, no? While waiting, especially the waiting time, it buys me time, no? While waiting for the test results, while waiting for me to evaluate the root cause, while waiting for the proper diagnosis, or while waiting for a referral to a dermatologist. Okay, so I value my relationship with a dermatologist. At least we should, all doctors, the primary physicians, meaning we are the first line of defense when it comes to the medical community, then that's the time we refer to a specialist. At least we should be able to give them something. And the Coco Cider is a very basic or primary tool that could address to this all sorts of skin condition. Very safe, very effective, organic.
For the past decade, you have seen the development of the medical world. How important is for the people to go back to the basics by using natural and organic ingredients?
Okay, number one, for us to be able to feel safe, okay, we should maximize whatever we have in the environment, okay, with the advent of technology nowadays, with the advent of mixtures of chemicals, with the advent of preservatives, okay. It's really hard, number one, to somehow trust products, especially the scented products, okay? Because if you smell something, it gives you this psychological impact that, oh, I so love this product, I'll use it, it will beautify me, only to find out it will further, okay? It could further exacerbate or damage your skin, okay? Not to mention that if you are living in a third world country like us, okay, you have to consider that we are somehow exposed to harsh environment, okay? The sunlight, which is very damaging to the skin. Not to mention pollutants. We are also exposed to malnutrition. So at least we have something that could give us a nourishment, okay? A nourishment, a safe product that could somehow give protection to the skin. Coco Cider, number one, is environment friendly, okay? On top of that, it's a proven and effective remedy to all sorts of skin condition. I can vouch for it because it's evidence-based. That's number one. It's all in the books. You can read it. It's not as if I'm telling you and you will doubt what I'm saying, because you can read it. You know, I always tell my patients, I always encourage them to read, because right now we are so empowered. We are so empowered because we have the internet. Only that you should somehow check on legitimate sites, okay? Do not go to forums. That's why there's this what we call evidence-based medicines, okay? I don't consider myself as a homeopathic doctor. I go for evidence, meaning if I tell something to my patients, it should be backed by research. That's why I'm confident to tell you that it's safe. Okay, I can vouch for it. And because it's backed by evidence, it's backed by research.
Thank you so much, Doctor.
You're welcome. You're welcome. You're welcome.